Hello student, good morning to all of you. Welcome to my YouTube channel. Today's topic to deliver non-steroidal anti-inflammatory agent. Firstly, objective. Understand the various analgesic, antipyretic and anti-inflammatory drug. And second point is identify the classification of a non-steroidal anti-inflammatory agent. Non-steroidal anti-inflammatory agent means these are the drugs which have a anti-inflammatory effect, means they reduce the inflammatory response such as a pain, fever, etc. by inhibiting the synthesis of a prostaglandin and a related compounds and autocoids. Anti-inflammatory means relief or a reduce the pain, and non-steroidal means these are two separate type of a painkiller from steroidal drug and non-steroidal drug. Steroidal drugs such as a morphine, they are typically used for the more severe type of a pain, and non-steroidal means do not depress a central nervous system, do not create a physiological dependence and a weaker analgesic result effect. They are mainly target on a peripheral action. And second point is a pharmacological action. First is a analgesic. Analgesic reduce a pain, and a good drug is a aspirin and safe in a nature. Analgesic drug should be a cheap, chemically stable and tasteful. And analgesic drug should be effective relief of pain of a different organ and produce a rapid action when administration by a orally or parenterally with a long duration of a action. Should not depress a respiratory system and should have a maximum safe to individual. And second point is a antipyretic. Antipyretic means elevated a body temperature, maintain a body temperature, regulate a body temperature. And anti-inflammatory means show effective anti-inflammatory properties. And pharmacokinetic, first absorption through the stomach and small intestine, and metabolism in a liver and easily cross the placenta, and excretion in a urine. And side effect, vomiting, gastric upset, pulmonary edema. And classification of a non-steroidal anti-inflammatory drug. First class is a non-selective COX cyclooxygenase inhibitor. First is a salicylate, example is a aspirin. Second is a propionic acid derivatives, example is a ibuprofen, naproxen, ketoprofen. And third class is a phenamate, mefenic acid. And fourth class is a anoelic acid derivatives, example is a peroxicam, tenoxicam. And fourth class is a pyrazonal derivatives, phenylbutazone, oxyphenylbutazone. Non-selective COX inhibitor means both are drugs in all are drugs in a COX first and COX2 are inhibitor. And second class is a superficially COX2 inhibitor, nimesulide, diclofenac, acylfenac, etc. And third class is a selective COX2 inhibitor. Example is a celecoxib and edercoxib and paracoxib. And fourth class is a anti-inflammatory action. First subclass is a para-aminol derivatives, example is a paracetamol. Second is a benzoxynate derivatives, example is a nepopam. Paracetamol drug block the pain and impulses peripherally, which occurs in a response in the inhibiting of prostaglandin synthesis. Thank you.